After reviewing Dr. Todd Grundy's video pertaining to an adjustment disorder, I was able to get a more in-depth understanding of the 5 criterions on how an adjustment disorder can affect a person's life. Dr. Grundy elaborated on the first criterion. There has to be an emotional or behavior symptoms has to be present in response to an identifiable stressor. However, the second criterion, within 3 months of the identified stressors, the emotional or behavior symptoms has to be present. In addition, he further expanded the third criterion. The disturbance symptom has to be significant to the extent there is distress in account to external context or cultural factors or significant impairment. The fourth criterion, bereavement is not normal within the person's presentation. The fifth criterion, these stressors should not last no more than 6 months. Dr. Grundy further pointed out there are 6 specifiers to adjustment disorder: anxiety, conduct, depressed moods, mixed and anxiety, depressed mood, mixed disturbances of emotions, conduct, and unspecified. Based on the symptoms and specifiers, to be diagnosed with an adjustment disorder can occur when there has been a person who has just gotten married, loss of employment, or lives in a high crime rate neighborhood. From a diagnostic perspective, an adjustment disorders the stressors the person is affected by cannot last 6 months and usually is not present anymore afterwards. Whereas when a person has been diagnosed with a trauma stressor-related disorder, which is similar to PTSD, depression, and anxiety, these disorders are stress disorders. Keebler, Morgan, Betch, Smolinski, Bellante, Galloway, Ojaha, Odo, Wilson, Bush, Blesser, 2022. An individual who has been diagnosed with PTSD has to have witnessed or been in a traumatizing event, and the person has to have symptoms of intrusion, avoidance, altercations in cognition, mood and altercations in arousal, and reactive, but has to have these symptoms present for at least 3 months. Mayo, Chan, Wee, 2018. American Psychiatric Association, 2023, stated that acute stress disorder is closely related to PTSD because similar symptoms are present, but in acute stress disorder, the symptoms has to occur 3 days and 1 month after the traumatizing event. I had a client who I counseled for about 6 months. This was a challenging effort because he was 10 years old who had a crisis every 3 days. My client had lived in a foster care homes and lived with his mother's mother for a while until she was not able to keep him due to medical issues. He was living with his father, who was just released from prison, and his girlfriend, who had 2 children that were living together. His father did not know anything about him besides him having auditory hallucinations. His mother and her boyfriend were murdered in front of him when he was 3 years old, and he had been having defiant behaviors at school. Once I started counseling with him, he seemed to be forthcoming and open some, but the next following week, his stepmother called and said he ran into the highway while he was in school and ran into the woods. He ran into the woods because my client said he was angry and he felt safe because the police officer lived there. From the 1st month to the 6th month, every Wednesday, every weekend, I was on a crisis plan with him and his stepmother because he had informed CPS, who is Child Protective Services, that his dad was molesting him, which at this point still unknown. To make a long story short, my supervisor, the case manager who assisted me with him, and I were so on point. We already had the paperwork ready and inpatient facilities ready to call. This young boy had gotten to the point the local hospitals did not want him in their hospitals. The local police department did not want us to contact them if he had ran away or was unsafe. And the inpatient facilities were limited due to his defiant behaviors toward others, and the schools did not know how to handle him appropriately. So the 6th month, he was transferred to a group home. He ran out of the facility into the hallway, got hit, and his leg ended up being broken. And this is the last time I've heard anything about the young man. One thing that always stuck with me was when he was at the sheriff's office our last time together, and he tried to fight the police officers. He said, "Miss Angela, I just want to be a good boy." He had always said that in his sessions. He said, "Can I sing all of you a song?" He did. Then he drew a picture of his family and drew a heart. Then he said, "I want to say a prayer." I knew at this point there was still hope for this young man. Even though he had been through so much and his psychotropic medications were just not effective for him at that time. When the specifiers and modifiers are present, the clinician will be able to understand the person's psychological and emotional factors which are associated to the accurate diagnosis or diagnoses, and to be able to provide the most effective treatment for their client. If there are not sufficient symptoms, then as a clinician, he or she will have to give a diagnosis based on the information provided by the client at that present time. As time progresses, the clinician is able to modify the diagnosis or diagnoses accordingly.